I started my practice in 1999. I've had patients with cancers over the years. I've had patients that are in their 80s. I've had little ones that are, 6 weeks old. So anywhere in there, if there's a structural thing, especially with the head and neck, because your head weight, the way it sits on your neck, and the falls that happen as a child, the accidents that happen through being an adult, that's how much the head weighs. Those type of things are what really will cause a misalignment, and there can be a lot of pressure on the brainstem and tension in the neck because of it. One of the reasons I think people should be checked even before there's pain is because only 20% of what the nerves do is communicate pain or sensory input. 80% of what a nerve does is communicate function. So you could have almost 80% of neurological compromise without even feeling it, without noticing it. So sometimes people will say, does everybody need to be adjusted and how often? And really it comes down to, that person's particular structure. Some necks, the way that the vertebrae are formed, it's more stable, and others are a little more less stable. And then some folks' lifestyle, there's more physical stress that they're experiencing than someone else. So there's a lot of varieties in that. But for the most part, when someone initially comes to me, I like to see them a little more often to get things really stable. And then once we get things stable, I like to put people out, and as long as they can go as far as holding the correction. If I can help somebody by giving them this adjustment, providing this type of care, really enjoy and pursue life like they would like to and like they were created to do, that's pretty much as I can ask for in practice.